Hello and welcome to Fast Talk, your source for the science of endurance performance. I'm your host, Trevor Connor, here with Coach Rob Pickles. It's not uncommon to see professional athletes get regular blood tests to help optimize their performance. The results, read by the right doctor, can tell a lot about the athlete's state of recovery, whether they're pushing overtraining, and where they may be deficient in their nutrition. So it seems like a no-brainer that athletes of all levels concerned about their health and their performance should get regular blood tests. But that's not actually what the research or even many sports doctors recommend. Athletes are different, even those of us who just train 8 to 10 hours per week, and those differences will show up in the results. A GP who doesn't know athletes may see issues in the results that a sports doctor would look at and say that's completely normal. This can unfortunately lead athletes to get anxious over the results, and worse, get them to make bad decisions. Our guest today, Dr. Lauren Rudolph, works with many top endurance athletes, and even at the highest levels, she questions the value of regular blood testing. We talk with her about why that is, why all of us should work with a sports doctor, and what, if anything, we should be testing. Both she and the research see a value in two particular markers, vitamin D and ferritin. But even those markers, as you may suspect, get complicated. Sharing their thoughts, we'll also hear from friend of the show, Dr. Andy Pruitt, owner of Build PT and Performance Center, Larry Meyer, physiologist, Dr. Stephen Chung, owner of Athletica.ai, Dr. Paul Larson, and ex-World Tour athlete Taylor Finney. So find out when your next physical is scheduled, and let's make you fast. Well, Dr. Rudolph, welcome to the show. We're excited to have you today.
Thanks.
So I guess the place to start, we're doing an episode on blood testing. What motivated this, we've gotten multiple emails from listeners saying, should I be getting blood tests? What should I be testing? And what should I be looking for? We get asked that actually quite frequently. I think I sent you the list of emails. They're pretty long. So we want to kind of dive into that, talk about should athletes be getting blood tested? Should they be getting a unique blood test? And what should they be looking for? And I know you have some pretty strong opinions about this. So let's dive into the first question of, do athletes need extra testing?
Yeah. So my initial reaction was actually no. Well, maybe yes. So then I started asking, I asked like 25 sports medicine physicians across the country.
She did her research.
Oh, yeah.
Damn.
And they all will say no. Initially, like their initial answer is no, which I think is actually fascinating because we're doing so much blood testing and biomarkers on the commercial side of things. And then we're doing a lot of screening. So like pro teams and collegiate teams will be screening preseason or quarterly. But really, these 25 primary care sports medicine physicians seeing athletes on a daily basis in their clinics, in training room, are really tailoring lab work to the individual and then basing that individual sort of history, physical exam, performance, thinking about several factors and then thinking about, do we want to be screening throughout the season? When do we want to screen? So bottom line, I think what I'm saying is it's individualized.
Yeah, and to dive into that a little bit deeper, in terms of general health, if somebody sees their primary care physician, then there may be, and you're the expert on this, then there's probably some blood tests that people recommend that you have done every so often, say your cholesterol or whatever else. But there's not necessarily, say, a panel that's like, this is the athlete panel, and every athlete needs to be getting these 10 tests done.
Right. There's a ton of research on this, a ton of podcasts, a lot of marketing about, what you should do. And I think where the science is going is fascinating. But bottom line, I think through this episode and potential debate, you could really boil it down to kind of a cost-benefit analysis where it's like you can look online and find out what each of these tests cost. And then what can I test to really improve performance?
So what I found really interesting leading into this episode, I was trying to do my research and I realized I can't sit here and research every single biomarker, every single potential panel.
Are you kidding me? It's your favorite thing in the whole world.
I didn't say I didn't want to do it.
Gotcha.
Yeah,
There's a question of
there you go.
I was expecting an educational lesson here.
You're the doctor. And that's the other reason I didn't want to do it because I knew I was going to get into the biomarkers. well, let's talk about AST. I read this. And then you're going to give me a look and go, you're an idiot.
Yeah, Trevor
And
Conner.
No,
MD.
but I mean, that's what's fascinating, right?
Yeah.
So the science on one end, everyone in their little world has a different opinion on a lab.
But what I ended up researching was, what are they saying? What are we seeing in the literature in terms of recommendations of blood testing with athletes? And I saw two very contradictory things. So I actually have a great paper from a friend of the show, Dr. Sam Milan, who basically said scientific monitoring is great. So he even says particularly biomarkers are becoming increasingly important. So he's all about, we need to be using these biomarkers. We need to look at them. And that paper dives deep into using biomarkers to look at indicators of overtraining. Now, very important, biomarkers and blood testing, not quite the same thing. All blood tests are biomarkers, but there are biomarkers that don't necessarily require a blood test. So it's a rectangle square thing, and we don't need to go too much into the details. But he was very positive about athletes should be getting these tests. We should be using these biomarkers. They're a great way to look at overtraining. But then I found two other studies, and we'll put these in the show notes. One is to screen or not to screen, commentary and review on screening laboratory tests in elite athletes. And then another one was clinical utility of blood tests in elite athletes with short-term fatigue. And they both basically said the same thing, which is when you're testing athletes, there's an extraordinarily high percentage of false positives, things that in a clinical setting, a doctor would look at and go, that's off.
And false
But
negatives.
A sports doctor would look at and go, well, of course, you're an athlete. So we would see that. And what they said is they actually both recommended against doing regular blood tests because they say it's going to cause stress. It's going to upset the athletes because the doctor's going to come back and go, well, that's off, that's off, that's off. And the athlete's going to go, oh my God, I'm dying.
Totally. I mean, if you just take a step back and think about it for a second, we're all over the place with recommendations. So, I mean, if we can hopefully all come together and get on the same page, that would be awesome. But Dr. San Milan, he's totally right. I mean, data is fascinating. And I mean, I think the hard recommendation is we should be getting blood work is a little bit aggressive. I think it really does boil down to the individual. And what we can kind of get into a little bit is what's important for endurance athletes specifically.
Let's take a minute and hear from Dr. Andy Pruitt and Larry Meyer, who explain why they think that extra blood testing beyond your regular physical is rarely necessary.
I don't think the regular person needs to pursue that unless they're entering a state of fatigue. And then they think they go to their internist and get baseline blood work done. I was a young racer in my youth, and I did get regular. I wanted to watch my white count. I wanted to watch my red count. I wanted to watch my iron levels. It's gotten much more complicated than that now because we can look for so many other things. My H&H was always important to me, the hematocrit and hemoglobin. They were factors in performance as well as health. So do I think it's important? And generally, no, I don't, unless you're at the bleeding edge of the sword, looking for those minute capabilities and advances, or you're in a state of fatigue, right?
Basic blood panel. I mean, you go get a physical every year, and that's going to cover everything from H&H to all your electrolytes. And so when it comes to just being healthy, get your physical. Sometimes juniors and those emerging athletes that just don't have their food diet down yet, maybe you can find some pieces of it. Like I have a young kiddo that could eat better, but it's, again, something simple. You just don't have to go too outlandishly crazy and spend a ton of money on data that's probably a little overkill.
One thing that I'd love to unpack here is maybe some caveats, right, that are important. And my assumption with Inigo's paper or recommendations is that he is working oftentimes, I think, with the cream of the crop.
Highly
right?
elite athletes.
Yes,
Exactly.
exactly.
Whose literal job in life depend on their performance.
And are also frequently running the edge of overtraining.
Well, that's my second point is
And they may or may not even know the labs because it can be a whole head game.
as the athlete
Right.
themselves. Correct. Yeah. You know, and that's the other part, Trevor, that you were touching on is that in a potentially symptomatic situation where there is this condition of overtraining that they are trying to either diagnose or understand. And I believe that those two caveats are maybe important in that we're not talking universal recommendations for me just trying to go out and climb Flagstaff and have fun while I do it. you
Right.
know?
Right. And what it really boils down to, well, performance for sure, but then also prevention. Right. I think that we're getting better at looking at biomarkers and prevention. But, it's interesting. A lot of the sports medicine community does not use biomarkers necessarily as evidence of overtraining. There's screening tools. I mean, I can give you several of the different screening tools that we can go into, but one of them, for example, is there's a large focus on mental health questionnaire.
Yep.
And a lot of the medical community feels that the diagnosis of overtraining or overreaching is not based on labs at all.
Which is really interesting. That study I mentioned, the clinical utility of blood tests in elite athletes with short-term fatigue, they had 50 athletes presenting with fatigue. And exactly what you're talking about. They did a health history of the athlete and diagnosed them based on that. Then they did the blood tests. And in 50 athletes, the blood test changed the diagnosis in only one athlete. The rest of them, it either confirmed or didn't help. But they did point out the fact that 78% of the athletes had at least one value that was outside the normal range and was inconsequential, just didn't matter.
Interesting.
Right. And I think the thought, too, is that some of those questionnaires, if you think of these as screening tools, these will pop positive before labs will become abnormal.
Yeah. And I know we're doing a great job of all the reasons you don't want to do blood testing. And I do think at some point we're going to talk about reasons that you do want to. But one thing I do want to point out, and is maybe specific with endurance athletes or elite endurance athletes, is that I think that there is potentially utility in blood testing if you have established kind of a long-term baseline and understanding of this athlete as an individual.
Yes.
Right? Then, because you can't say something like, oh, your hematocrit is 42. Maybe for you that's totally normal. Maybe for you that's actually 10 points lower than it normally is.
Totally.
And so it's kind of a one or the other. A one-off blood test every once in a while does not paint a picture at all. If you're going to do it, you need a lot of data to understand what it means.
Right. A normal value could actually be falsely abnormal in a certain situation. I mean, we can even go into certain, examples and scenarios. I think iron is a good example. Your ferritin might be quote unquote normal. And if all you're doing is screening ferritin and your ferritin is in an acceptable ferritin range, but you're testing right after exercise, for example, or you are overtrained, it's going to be falsely elevated. It's an acute phase reactant.
Yep.
So
to inflammation, right?
Right. So then the argument of screening ferritin with one other additional lab, add CRP, for example, or CBC to make sense of lab number one is really important. And I think that just brings up another point. It's like, can you get away with one or two labs, or does it really matter the whole conglomerate of labs and making sense of the noise, I guess?
Yeah.
Finding the signal in the noise, maybe?
Yeah, I think a lot of people can put faith into singular numbers, right?
Yes,
and I'll say this. Who in this room has the highest hematocrit? It's probably me. I'm oftentimes between 50 and 52 for my hematocrit.
Oh, no, I'm dehydrated.
No, I know, right? And so, but Trevor, who's the better endurance athlete?
Oh,
you are.
Right.
So my hematocrit's really high. Am I the best in the room? Hell no. That is not the truth at all.
Right.
And so we can tie numbers that, if only my value was at X, then I would be flying. No. It doesn't work that way.
Yeah, I might be the better endurance athlete, but to give you credit, you're probably going to die of a heart attack before me.
Probably
syrupy blood.
And my hematocrit makes me a better sprinter too, Trevor, just so you know. I really leverage that hematocrit to outsprint you.
So before we dive into some of the specifics, I do want to ask the question, and I think this is just important. We're talking about endurance athletes right now, not elite, high level, you're going to the tour endurance athletes, but most of our listeners and us who are recreational do some hard training. What are some indicators we should be aware of to say, yeah, you need to go see your doctor? Whether you get a blood test or not, you should just be going and seeing your doctor.
Totally. So I'll put a plug in real quick before I forget. For recommendation number one, let's call it, is get yourself a primary care provider that is sports medicine trained.
Yes.
And general recommendation to see them yearly and discuss labs, follow-ups, what have you. And then, so indicators, Trevor, what do you mean by indicators? Situations, symptoms, conditions?
I was intentionally keeping it vague.
Okay.
but you called
I
me
like
out.
it.
I know.
Yeah.
Jeez, that was a
That
little
was
bit
a
of a
good question.
spicy question there.
Was it?
It was.
Are you alluding to anything? No.
No, I'm not. And
Okay.
we did a whole episode, and we'll put it in the show notes because I can't remember the number, but an episode where I talked about my whole experience with overtraining.
Yes.
And this is part of why you brought up see a sports doctor. I went through months of hell where I was overtrained. I
Okay.
had all the symptoms of overtraining. I had no idea what it was. I went and saw my GP. She had no idea what it was. She put me on an antidepressant because she thought I was depressed. I had a severe reaction to that. And it just went downhill from there. And I ended up spending 2 weeks at the Mayo Clinic being tested for everything. They thought I had MS or all these neurological
Really?
conditions.
Man.
And the whole experience was scary. And they test me for all these things. And they're just going,
Well, good thing you're on the antidepressant.
we just can't figure out what's going on with you. Yes.
You're like, but I dealt with it really well.
I was happy. You have MS. That's
Great.
cool. The worst part of it was they had me see this. I didn't tell this in the previous story. My eosinophils were really high because on top of all
Sure.
this, I was suffering from allergies.
Yeah.
And they sent me to this doctor and he goes, "Oh, your eosinophils are really high." And I go, "What does that mean?" I had no idea at the time. And he goes, "Well, it's two things. One is allergies." I go, "Okay." And I go, "What's the other one?" He goes, "Well, this is really cool. I wanted to tell you about this because I was actually the person to discover this. There's a condition called eosinophilia." And he's like, and he tells me how horrible it is. He's like, "Yeah, if you have that, you die."
Yeah.
And I'm like,
right.
"So
or
do I
it's
have?"
Claritin.
So I literally just look at him and go, "So do I have allergies?" And he goes, "No, I don't think so." And I'm like, by process of elimination. And then he gives me
epic.
this speech on being a hypochondriac. I'm like, I'm not a hypochondriac.
Or at least I wasn't, but I might be
You
now.
just did it to me now.
Oh,
But
wow.
They
Okay.
never figured it out. And it was
Yeah.
years later when I was studying physiology, I read a whole paper on overtraining and went,
Yeah.
"Oh my God." And that, I realized later on, had I just seen a sports doctor,
Yes.
the sports doctor would have said, "You need rest," and could have saved me from a whole lot of pain.
Totally. And I think from the coaching perspective, you know more about this, but periodization has become much more popular and we're much better at trying to prevent overreaching and then overtraining. But seeing your primary provider who's sports trained can help identify overreaching, rest. The prescription would be rest 2-3 weeks, relative rest, not decrease overall intensity. And then come back and, that's like our basic test. We don't even necessarily need blood work or anything. And ultimately we want to avoid overtraining.
Mm-hmm.
I'm trying to think about this from the perspective of if an athlete is listening and something feels off.
Yes.
Or a
Okay.
coach is working with an athlete and they're kind of observing maybe some changes in the athlete's
Yeah.
performance or even changes in their mood state. What sorts of signs and symptoms there do we say like, hey, maybe because if you recommend to an athlete, like, I think you should see your doctor, like that's a pretty big deal that you shouldn't take lightly. So how would somebody like a coach know to make a recommendation like that? What do they need to see before it becomes real enough that they have to cross that bridge?
Right. Let's summarize these in a consistent manner. Elevated resting heart rate, sleep disturbances, mood derivations, and then, also not meeting previous performance goals is another good one.
Now, is this abnormal? Because here's the thing with an athlete,
It's hard.
fatigue is normal. You're doing hard workouts. You should wake up the next morning.
Totally.
tired.
Yeah.
So at what point do you say,
Change in performance maybe is a better way to think about it.
Yeah.
okay,
Not meeting goals that you were previously meeting, or potentially from a coaching perspective that you're expecting an athlete to meet that they're not.
yeah.
And I think that there's probably a chronic consistency to some of this as well.
Yeah.
I mean, if an athlete of mine has a really hard block of training and maybe they have some sleep disturbances with that, or they do a workout kind of later at night, they don't sleep that well that night, that stuff might be relatively normal.
Right.
But if we're seeing this for 1 week, 2 weeks, 3 weeks, it's not going away. one bad race isn't a bad news, but if your performance is going down over weeks, then that's a trend.
Right.
And also be aware, we're talking about a big drop in performance. So, just to make sure we're not sending a bunch of people to the doctor. Let's say you're doing your intervals regularly at 320 watts, and then you have go out and do a session and you're at 300. That's not a go see the doctor. That's you're tired. You probably shouldn't have done the workout. Get a night of rest. I can tell you when I was going through overtraining syndrome, I didn't have a power meter at the time. If I had, I probably couldn't have broken 200 watts. So it's like you're normally doing 320 and now you can't even do what you would consider.
I would say that you should have seen a doctor before that happened.
Probably. Anything else that you would say?
It's interesting, so in endurance sports, coaches play a really important role. Similar to in team sports, we have, athletic trainers. The whole sports medicine team is super important. That whole multidisciplinary approach, which maybe was kind of the goal of some of this podcast to begin with, was to kind of bring everyone together and get on the same page. But I really do trust, Grant's not here, for example, but when he comes and says, hey, I'm worried about this, he's my eyes on the field or on the ground, as they say. Yeah, I really do trust that information. So I think that daily sort of knowing the athlete too and their performance goals is super helpful.
Yeah. I'm going to throw another one out there. What about amenorrhea?
Yeah.
That it can occur in female athletes?
Sure. So I kind of came up with a big picture summary list of several issues unique to endurance athletes: overtraining, overreaching, altitude training, anemia, iron deficiency, irrelevant of anemia, vitamin D deficiency, and then also relative energy deficiency in sport, which is what you're maybe getting at a little bit. And so then, I thought about those issues that are key to endurance athletes and a big picture list of things that I would want an athlete to come see me in clinic for would be, decline in performance, we touched on, fatigue, relative fatigue, emotional disturbances, mental health kind of issues, prolonged recovery, the increased resting heart rate, sleep disturbances, but then also, where you're maybe going with this, bone stress injury, missed or irregular periods in females. I am consistently surprised at how common and accepted those things are. And so, that's kind of my summary list of our topic. Do you find that is still pretty common and accepted? Because I think, you mentioned anemia in females, but it's more than that, and we can dive in.
No, certainly. What I'll say is I think that we work with, at times, a variety of endurance athletes, and whether or not things are common and accepted anymore is hard to say, but I do think that you see certain issues in groups, right? I think that anemia, bone stress injury, those things tend to happen a little bit more in runners. We can talk about reasons why that is, hemolytic anemia and whatnot.
Right.
I think that we certainly see some of this a little bit less in cyclists. Bone stress injury in cyclists, relatively rare, let's be honest.
Yep.
But there are potentially other reasons that they would need to see their doctor. So
Yeah.
I was just going to say, I have every single one of those symptoms, but they still haven't found a solution to my problem.
More carbohydrate.
Yeah. Old age. Literally.
You just need more retinol, Trevor. Then you're going to be fine.
Every one of those things happens as you get older.
You just brought up testosterone. I told you, no testosterone.
That's fair.
So going back to your question, anemia in females, what are you getting at with that one?
Oh, not necessarily a question.
Yeah.
This was all just sort of thinking of reasons that somebody might want to see a doctor that they have, right? And so that's where sort of the amenorrhea and whatnot comes
totally.
from. So,
Right. Yeah. I think bottom line here, missed or irregular periods is not normal.
Yeah.
And you should
might
see
want
your
to talk
doctor.
to somebody.
Yeah,
exactly.
Totally.
Yep.
And the reason is not because we necessarily want to regulate menstruation, because I think that's a common misconception as well. But ultimately, we don't want to derail your season. The risk of bone stress injury is one that we talked about, but then there's also just overuse injuries, of other kinds, tendons and such.
Yeah, I am very glad to see that the mindset on this is changing. There was a time not all that long ago where you asked a coach and a female athlete wasn't performing until she was amenorrheic.
Yeah.
And that's not the way it should be.
Right. Yeah. And I get it. I mean, I remember in high school during track season, I thought that was cool. Like, oh, I'm going to work hard to try and get rid of my period. But turns out.
It's a really odd badge of honor.
Yeah. Right? I know.
This is like people competing to have the lowest whoop score.
Totally. But it makes so much sense.
Yep.
I'll be thin enough. I won't have my period. How great is that going to be? Right? But it ends up leading to a ton of problems down the line. And interestingly, you can't always gain all those back. So you can gain some bone health back. But I do think we're seeing a lot. I see a lot of athletes in clinic. I guess we can just call them masters athletes because everyone in this room probably classifies as a master's athlete, right?
Yes.
At this point. And poor tendon healing. I see that all the time. And I wonder, we start digging a little bit. I've always wondered, did you have stress injuries when you were a runner, when you were younger? And it turns out there is a lot of disordered eating or just improper fueling that's happened over time that's led to long-term problems, like 20 years later.
Sure.
Mm-hmm. Oh, absolutely.
Yeah.
We asked Dr. Paul Larson his thoughts on regular blood tests, and he did make the point that every athlete is different and we should get regular baselines.
For me, I use blood tests dependent on the context. Often in a high-performing athlete that can afford to do things like altitude work and other things like that, it's nice to be able to get a blood test. And, a standard CBC with ultimately you ask, get whatever you can. So if you can get a bunch of immunology markers on there as well, the whites and the reds and others, then that can be really helpful to monitor. When you start working with them, get a baseline, and then as you move through the process, get a routine assessment of those same sort of markers. And again, the initial marker can be really important because it will provide a baseline for you to be able to kind of compare against in the future when you're going to be looking at it later.
So let's start diving into some of the specifics here. And so I know I have been using the right terminology because every time I change the title, you've put a comment in the outline saying, what do you mean by this? But if you go to your GP and say, I need a blood test, you're going to get a general metabolic panel. And as I said, what I found surprising in the research I read was how negative the research was towards those, saying you get too many false positives with athletes. GPs often don't know how to interpret it. It causes stress. And literally one of them recommended don't do them with athletes.
Right. And so real quick, metabolic panel off the top of my head is going to be looking at markers of like liver function, right? You have LFTs on there. You would have some kidney function, some electrolyte balance.
Well, that's why I said, what is a general panel? I mean,
that's the thing. It's different with every...
It should be. It might not be, right?
Yep.
I think, again, that probably just goes back to seeing a provider that is sports trained. We really do try and be individualized. But what is a general panel? Is it CBC, CMP, BMP, looking at blood counts, so levels of cells in your blood, chemistries, sodium, how much does that matter?
And I will say, I mean, you go to different doctors, you're going to get a different blood test each time. They have their own specifics.
Appropriately so, right?
I still remember when I turned 50, I went to see my GP, who is a sports GP. Mm-hmm. And she said, we want to do a blood test. And then she said, you're an athlete and you understand this stuff. What specific things do you want tested?
Yes.
The funny thing was, it was like a kid suddenly finding himself in a candy store.
Really? You're like, give me the paper, lady. I'll check things off.
I've actually done that.
Oh, okay.
Check what you want.
There were so many things. I'm like, I don't know which to grab. So in the end, I'm like, just whatever. I didn't ask for any specifics because I overloaded.
Well,
Right, but what they're ultimately trying to get at is what are you worried about,
Yes.
right? Because we really shouldn't be testing things if it's not going to change our management, right? Because
Yes,
if
exactly.
you test something and it's abnormal, okay, great. What are you going to do with it? If you test something and it's normal, what information does that give you?
Yeah. Yeah, certainly. I also think that it's odd, medicine in our country, correct me if you feel a little differently because you're the practitioner, but it's amazing how many advertisements we have for medications. Go to your doctor and ask if you have this crazy syndrome, but you have potentially no symptoms of that. Like, and it's the same thing
Right, and then
here.
they list symptoms.
Yeah, exactly. Here's the things to ask.
You're like, I might
Here's what
have
you should
that.
be feeling. Yeah. And it's the same thing kind of with the athlete stuff sometimes, right? Like, oh, I'm feeling tired and my performance isn't great. Like, what shortcut can I try to figure out? Oh, I'm not performing well. My hematocrit must be terrible. Or
Right.
my iron must be low. Like, no, sometimes it's just you're not as strong as you think. Sometimes it's just you're not doing the training, and that it's not that there's anything wrong with you per se. It's that everything is normal.
Right. And we're trying to kind of come up with things and reasons why to go see your doctor. But I mean, maybe it's reasonable to just check in. I mean, I think we worry about all these different lab values and we get anxious about one single value being off. But I do feel like us as primary care sports physicians are here to kind of talk you through it.
And I think that's my point, right? Everybody should see their doctor and they should work with their doctor to come up with an appropriate plan or to investigate things. But I think that it's backward to go to your doctor and say, hey, doc, I need this test because I have this problem. No, that's a conversation that ought to come between the two of you.
Yeah, ideally, although it probably doesn't always work out that way.
So here's a question that I have, because you brought this up at the beginning. I brought this up as well.
Mm-hmm.
A sports GP is going to look at you fundamentally different from a GP who doesn't have the sports background, or at least they're going to have a better understanding of what they are looking at.
Ideally, yeah.
So, I'll just give a couple examples. Think about the metabolic panel. Something that's going to be frequent in a metabolic panel is C-reactive protein. That can be elevated. If you did a couple hard workouts and you go get a blood test, it's just a response to the workout you have. Another good example is creatine kinase, which can be elevated in an athlete, and that's completely normal. A GP who has no sports background might look at those, compare you to somebody who's not an athlete and go, those are abnormal. There might be an issue here. Where a sports doctor is going to look at those and go, yeah, you're training.
Right.
And understand it. So,
or not even order it. So, maybe we should just dive in a little bit to what these labs are. So one lab, CBC, which stands for complete blood count, is probably your most common conglomerate or panel of labs. Includes hemoglobin, hematocrit, red blood cells, white blood cells, and then a smattering of other cells, so to speak. And then CMP or BMP, these are chemistries. So you're looking at sodium, chloride, potentially starts to look at kidney function indirectly or liver function indirectly. But then ESR, CRP are two markers of inflammation, both a little bit more short-term and then long-term. Those are separate. So they're not going to come with those other panels. You'd have to order them, and arguably order them if you're in the most typical of situations. Those are ordered when you're looking for rheumatologic disorders and inflammation of very high levels.
Yeah, so real quick, just to explain and put this into layman's terms, C-reactive protein, CRP, is a level of an inflammatory marker in your blood. And ESR is essentially how quickly your red blood cells fall out of solution, right? Because if you leave blood in a tube, it tends to separate. The faster it separates, the more inflammation you have. So a high ESR means you have a faster separation and therefore more inflammation.
and just to add to that, remember, exercise, particularly high intensity exercise, is damaging to your body. Your immune system is going to respond to that. It's actually your immune system that does the repair work. But there is going to be inflammation. You put this to a test, do a hard workout, then get a blood test, 12 hours later?
Yeah.
You're going to see some elevated inflammatory markers.
And so to tie one other concept that Dr. Rudolph had mentioned earlier, when you do look at a marker like ferritin, and I think we're going to talk about ferritin more deeply, but I want to talk about it now because ferritin goes up with inflammation in the body. It gets released into the bloodstream. And so, as she mentioned before, I'm just tying all this together, you would want to have a second inflammatory marker looked at, because if your C-reactive protein, which is a marker of inflammation, is high and your ferritin is high, your ferritin's probably high because of inflammation, not because you have extra iron stores like we would otherwise look at ferritin for.
Right. And that's because of hepcidin.
So here's my question to you, and then maybe after that we dive into iron. But how, quote, and I'm doing the air quotes thing, serious does an athlete need to be to say, I should probably be seeing a sports GP? And I'll just say, I am not nearly as serious a cyclist as I used to be. Certainly when I was serious, the center had sports doctors for us. But even as a recreational masters athlete now, I'm still pretty insistent on I want to see a sports GP because I still have what would be considered atypical, but is typical for an athlete. That's still the case with me. So talking to our listeners, we got a listener right now who's going, I just train 8 hours a week. I'm not that serious. I don't need to see a sports GP. Are they correct? Or is it better safe than sorry and they should be seeing a sports GP?
I mean, I would say better safe than sorry, honestly. I mean, there's so many of us. And I think I provided a link of how to find one. So you can put that in the notes if you want. But yeah, there's so many of us. I would say if you're even remotely considering yourself an athlete or endurance athlete, you should be seeing a primary that has training in sports. I mean, because I don't know how much you know about our background, but you can be a sort of slew of different specialties. You can be primary emergency medicine trained, internal medicine, pediatrics, physical medicine and rehabilitation, or family medicine trained in your primary specialty, and then go and do a sports medicine fellowship. And after sports medicine fellowship, we all consider ourselves primary care sports medicine physicians, but the number of us that do primary care is pretty high. Right. I mean, I do actually less than a lot of us.
And at the end of the day, in some regard, there's no reason not to, right? If a doctor has a sports medicine fellowship, it's not like they're deficient in another area because they're sports medicine trained. It's somewhat in addition to the standard medical training.
Exactly. Yep.
Let's hear from Taylor Finney, who raced at the World Tour level, but points out that when it comes to testing, he's far more concerned about the health side than the performance side.
I'm more interested in my body now than I was when I was an athlete. I would do blood testing and I would send my results to my coach and I would basically just wait for him to tell me if everything was good, and my doctors obviously, and wait for them to tell me what was good and if there was something bad that we needed to do something. But I wasn't as involved as I would be now.
If you could go back with the knowledge you have now and redo it, what would you do differently? What would you focus on?
More on the whole, I think I would care less, and in some ways I would care more about important things like my physical health. And I think when you're an athlete, it's really easy to feel like you're always sort of chasing after this ball that is sort of constantly escaping you, and you always feel like you're behind and you need to be doing more of this, or your certain values need to be here, and you're always I always felt like I was sort of late for a flight, and running through the airport. And if I could go back now, I would think I would just kind of I would try to prioritize accepting where I was and really being okay with that, and then implementing small strategies to slowly build towards where I wanted to be, not think that I just had to be at this one place and try to make overnight changes, but implement smaller things.
Listeners, this episode of Fast Talk focuses on understanding blood testing. For more, visit fasttalklabs.com and look for Dr. Andy Pruitt's article, Demystifying Your Blood Profile. Dr. Pruitt will introduce you to all the components of human blood to help you understand your own lab test results. And do-it-yourself lactate testing is part of your training. Look for my Endurance Athlete's Guide to VO2 max and lactate tests to help you prepare for the most accurate results. Visit fasttalklabs.com for more. So let's dive into a couple here. And what I love, so again, I actually appreciated how much work you did on the outline. Because we send the outline to all of our guests. And I can't tell you how many times the guest shows up and is like, I didn't even look at it.
Dude, you're showing how the sausage is made, man.
Yeah, I'm sorry.
The sausage.
She rolled in here with all this knowledge off the top of her head, just like we do, Trevor.
Well, she did already have all this knowledge off the top of her head, but on top of that, she took this very seriously, and it's truly appreciated. In the original outline, I had a whole bunch of markers, and you just had notes of why, don't want to talk about that, why this, why that.
Yeah.
But I had iron and I had vitamin D, and you were like, yes and yes.
Yeah.
And to your credit, though, even those studies that were saying reconsider doing a full metabolic panel with athletes were like, iron, vitamin D, yes, test them.
100%.
So let's dive into iron and ferritin.
Okay, let's dive into iron and ferritin. Where do you want to start?
A big old pool of iron and ferritin.
Yeah, which, right. I mean, and, you know, the outline was ambitious.
Yes.
This is why Trevor gets overtrained.
Yeah. Yes, the outline was overreaching and potentially overtrained.
Podcast overtrained. I am just not performing in podcasts the way I used to. Rob is noticing.
You know, I genuinely think, you know, I gave you kind of a summary of topics. I genuinely think each of these topics deserves kind of its own show or light, and potentially an expert. You know, like, I didn't mention this, but I'm not an endocrinologist.
Well, maybe you should be.
I know, right? And yeah, like I said, if we're going to talk about hormones and testosterone, you need to get an endocrinologist in here because that's just messy. But yeah, let's dive into iron and vitamin D. What do you want to start with? Vitamin D is probably pretty simple and straightforward / super confusing. You want to go there?
That was very clear.
Yeah, exactly.
Yeah.
I mean, I will say with the rise of Zwift, then I'm sure there are more vitamin D deficient athletes because everybody's spending their time inside now.
Right.
Which is a good point. So why is vitamin D important to an athlete?
So vitamin D for athletes is controversial to some. In my opinion, it's important enough to talk about. So we're going to talk about it. Vitamin D, obvious or not obvious, important for bone health. And then a newer recent systematic analysis came out showing that it maybe actually is important for aerobic endurance and anaerobic power, potentially even strength, which I think is really interesting because ultimately this podcast, I mean, we're trying to improve performance, right? Maybe?
Part of it.
Yeah.
We're trying to make half-beer, healthier athletes. And you do that by winning. Just so you know.
Perfect.
That's going to be our new slogan.
So we're all on the same page. Great.
Yes.
So honestly, vitamin D has been a hot topic on and off. Even in the medical community, the non-athlete community, vitamin D is aggressively disputed. But nonetheless, still deserves to be talked about. So what are we talking about here? So we're talking about, so the lab value, if you want to go get your vitamin D tested, it's serum 25 OH. There's other lab values out there. Okay. Make sure you're actually getting that lab value.
Serum 25 OH. Yeah. Once again.
Well, vitamin D, right? Because there's vitamin D3, there's vitamin D2. You know, what are you testing? What are you going to supplement with? The general recommendations, which I'm going to say, but I don't know.
I know. There's reluctance here.
Oh, yeah. I'm not going to necessarily say I believe this because you're going to see people on a ton of different levels of vitamin D. But the recommendations, something between 600 to 800 international units a day.
But that is being highly contested.
Highly.
And there are plenty of studies that have shown the original basis for that wasn't necessarily correct, and it actually needs to be much, much higher. And there's still not a resolution on this.
Yeah, I was going to say
100,000%.
Yep.
But nonetheless, I feel obligated to tell you what the general recommendation is.
Yep. And remember, they are making a recommendation of a vitamin that is not actually a vitamin.
It is a hormone.
And it doesn't even meet the requirements of vitamin because your body can produce it.
Right.
My
fat
body
soluble.
can't. I wear so much sunscreen. And I ride inside when I have my sunscreen on. So I take 50 billion IU of vitamin D every day, twice a day, in fact. I'm taking it right now.
He just has a vitamin D IV.
It's a drip. It's a vitamin D drip, in fact. It collects it from the sun and it puts it straight into my arm.
This is why he's so happy.
No, I've been stealing your antidepressant.
I'm sorry, we are not helping you here.
No, I'm trying to think about what is actually important about it. I think what I want to get across is I still believe we should be supplementing based on levels. So this test is actually worth something.
Because it is leading to an actionable outcome.
100%.
And the other thing I found interesting in the recommendations is you should be tested twice a year, late winter, late summer. So test it when you're at your peak and when you're at your low point, potential low point.
Yeah, I think that's fair. I have this conversation maybe too many times. So in all fairness, there's evidence that it is helpful in prevention of upper respiratory infections. And that has come up a lot recently with COVID. And so people will be taking 5,000, 6,000 IU without testing. You could be really high. And high vitamin D isn't great either. So I really think this lab is actually beneficial.
Yep.
So is this just a lab that people ought to just be doing? Kind of, Trevor said recommendation, twice a year, high and low points. Or is this something that people ought to be waiting for some sort of sign or symptom that says, oh, you need to get your vitamin D tested, as opposed to just doing it, say, prophylactically?
I will reluctantly say you should just get it tested.
Whoa.
Yeah. But now we're gonna see like a quick increase in vitamin D testing at Boulder Community Hospital.
I know, I was going to say, I'm seeing Jason, your partner, on Friday, so I'm going to, I'll get a little vitamin D script while I'm there.
Yeah.
But
I'll just give you a handout to go to the lab and you can check all the boxes.
I'll check all the things that I want. Yeah, perfect.
Yeah.
Just order off the menu.
Yeah, exactly. I'll just give you, you just choose the menu.
Love
and
it.
What is very interesting, though, is you point out the fact that they're still really debating the RDAs. But based on a blood test, there's very clear recommendations on how much you should take to get to the optimal level. So what's considered deficient is below 25 ng per ml. And unfortunately, I'm not looking at the study that I read this in, but as I remember, so you want to be in that kind of 50 to 70 range is somewhat optimal, somewhere around there. And you have a look on your face, I got that completely wrong.
No, it's right. It's debated.
Yeah.
I think, actually, I should mention, different labs have slightly different values.
Fair.
So we're sitting here starting to spew out some specific numbers and trying to make specific number recommendations, but depending on the lab, there's going to be a slight variation in what is considered normal. And again, this is normal values for athletes and fans and has nothing to do with you at all. Like, it's not tailored to you. So yeah, lower limit normal, approximately 20 is kind of considered abnormal. My goal for athletes is 50.
Yeah.
And that's what I was going to say.
Yeah.
Is there a difference between normal, acceptable, and optimal as we're talking about this?
Right. That's a great point. So yeah. So normal, greater than 20. And again, that range is going to change. I would argue 50 is optimal for athletes.
More is better. Perfect.
Yeah.
That's the sound clip right there. You heard it here first.
But not too much. Right.
Yep.
So
testing your levels.
I should
right?
only do my
let's
drip
say you
half a
don't
day.
supplement, okay?
Mm-hmm.
And you come in and you're like, I want to test my vitamin D. I don't supplement vitamin D. I'm outside. Yeah, I use some sunscreen. I eat clean or I eat well, whatever. And we test it and you're at 50. Great.
Mm-hmm.
Keep on keeping on.
Perfect.
We're not going to do anything else.
So I'm going to admit to you, I'm looking for it, but the reason I said the 50 to 70 and absolutely love that is I am a part-time evolutionary biologist.
Ooh.
I love studying that. And somewhere in this paper, they say, the belief was we were 50 to 70 during evolutionary times. So that would be optimal for us. And I just read that and went, thank you.
How can you possibly know that?
Oh, that's amazing.
Here we go. Optimal concentration thresholds are not yet established, but are proposed to fall in the range of, 40 to 70, which is believed to be the concentration in which the human genome evolved.
Oh my God.
Amazing.
Love a sentence like
You
that. That's
evolutionary biologists, we're all the
This is
same.
what I came here for.
There we go. But the other thing they do say, which is interesting, please respond to this, is they said, if you want to raise it 10, you need to be supplementing with an additional 1,000 IU for a couple months to get that rise of about 10.
Yes, theoretically that's right. But in practice, I don't always see that because absorption can be an issue. Something we didn't start talking about with endurance athletes is gastritis and absorption and difficulty getting appropriate nutrients. Like if we dive into ferritin, but vitamin D is the same.
Yeah. So real quick, gastritis, right? We're talking about an inflammation of the GI, the gastrointestinal tract that can be common due to decreased blood flow in athletes to the GI system as you're exercising. So.
Right. Super common. I mean, we're increasing our movement of our GI tract, right? So even just increased acid can be a problem.
So what we are seeing here, which thank you, you stated this right from the beginning, it's very clear, very simple, and highly confusing.
Get it checked.
Yeah.
This is one that you have to go get checked. And based on the value, it recommends how much you ought to be taking. So it's an actionable lab test. Perfect.
Yeah. I mean, if you wanted to summarize vitamin D, I think it's a completely worthwhile test to obtain and then talk about supplementing with your primary sports doc.
Or in Rob's case, get the IV.
Yeah, just get on the drip, man.
Okay. Anything else about vitamin D before we move to iron and ferritin? All right. So where do we want to start with iron? Because I know this gets a lot more complicated.
Yeah. Well, and potentially, I mean, you could argue vitamin D is just as complicated, but making it complicated makes it easy to not talk about.
Right.
So iron, again, another hot topic in endurance athletes. And when we talk about iron from the biomarker perspective, we're really talking about ferritin, right? You can screen ferritin, or you can get a whole iron panel, back to your topic of panels, add a CBC, add a CRP, ESR. We can talk about a whole slew of things. I'm not sure what direction to go on iron necessarily. Thoughts?
Yeah. And real quick, what I'd actually love to do is
as opposed to giving like a lecture on iron.
I want to explain why ferritin is important.
Yeah.
Right. So we talk a lot about iron, and we know that iron is important for things like hemoglobin, and it's involved in oxygen transport. But this ferritin term might be really new to people. And the reason that ferritin is important is it can actually store iron ions literally within the ferritin molecule itself. And so it's acting as if it's an iron reserve within our body. It's our iron bank account in some regard, right? And so that's where if we need additional iron for other processes, we can dip into our ferritin bank account and take that iron out. So that storage system is really important. But as we talked about before, it can also release that iron with inflammation processes and hepcidin activation. So that's the reason that we're discussing ferritin is we're kind of asking how big is our iron bank account?
Totally. I love the iron bank account analogy.
Spent a lot of time working in a medical clinic explaining stuff to people.
Yeah, that's a great one. Yeah, I do like to summarize this topic a little bit with terms. Anemia means low hemoglobin. Doesn't have anything to do with iron necessarily. Doesn't have to, right? Separate category. Hemoglobin carries oxygen, and then probably ferritin as the bank account. Ferritin is the storage.
But so the question I have for both of you is, as you said, ferritin is the storage, it's not the iron itself. But sometimes you can see a drop or an increase in ferritin that isn't related to the iron levels in your body. So how do we account for that in a blood test?
Yeah, I mean, I'm not going to talk about it from the blood test side of things, but what I'll say is, depending on various situations, you have to dip into that savings account at times to maintain your adequate iron stores, which is why you're potentially seeing ferritin be low, even though your iron count hasn't necessarily changed, even though your hemoglobin hasn't necessarily changed. So I can keep talking if you want, but I'll leave it there.
Dr. Stephen Chung understands well the challenges of masters athletes. He explained why those of us who are over 50 may need more regular testing, particularly to look at our ferritin levels.
I think there are value for athletes to get blood tests, and I would say especially since probably a lot of our target audience are masters athletes. As we age, I think it is important to get blood tests at least kind of once a year to just have an overall checkup. I think too many of us rely on us being, we're healthy, we're fit, we don't need a physical each year. And, that just develops bad habits down the line when you are past 50 like myself and say, well, I don't really need the doctor, I feel fine. And I think it is good to get into that habit. And I think there are key parameters that you can look at, whether it is your hemoglobin count, whether it is your iron levels, to be able to change things about your diet and about your training and, again, your readiness to train. So I think those are the values of blood tests too. Obviously, besides just general health and, are you a healthy individual? Are there any medical concerns that we need to know about? In terms of actionable things, I would say one of the big things is iron levels. And also, if you can get a sense of your hemoglobin count, your hematocrit, those are all good values to again, along with your cholesterol levels, to know whether, again, you're healthy from that perspective.
So I know there is a ton to talk about with iron. Maybe we can try to keep a higher level to this. As you pointed out, we could do a whole episode, probably a whole series of episodes covering all the complexity of iron in the body. Mm-hmm. But two questions that I have are, at a very high level, what is the importance of iron to an endurance athlete? And then I certainly read that endurance athletes have a higher risk of being deficient. So why is that?
Yeah, I mean, I'll jump in here with some of the summary, and then Lauren, you can fill in with the correct details if you want.
Or the clinical side.
Exactly. Yeah. I'll do it from the layperson side. As we mentioned before, and as we've talked about in past episodes, right, oxygen, obviously super important to an endurance athlete, and our ability to carry oxygen, well, that's because of hemoglobin on our red blood cells. And, I know I said that earlier, having the highest hematocrit isn't necessarily the greatest thing in the world, but we do all need to have red blood cells, right, to be able to do this action. And because the iron is important in the creation of the red blood cells, well, there's one reason, right? But the other side of this too is that athletes tend to experience more of a loss or a turnover in red blood cells than a sedentary individual. And depending on the sport that you do, if you're a runner, you can actually be crushing red blood cells in your feet every time that you're running, every time you're taking a step, especially if you're on hard surfaces. And because you're breaking those red blood cells, then you're losing the hemoglobin and the iron out of there. Other things like increase in body temperature, or even just shoving all these red blood cells around your body at higher blood pressures and higher rates of speed can cause more of that turnover. And so we're constantly rebuilding our red blood cells to even just maintain a normal level at a rate that's probably faster than you would see in a sedentary individual who otherwise didn't have any diseases or anything. So, I think that that's one reason that we're going to be seeing an increased iron need in an endurance athlete.
Yeah. I think that's a great summary. Potentially also will add symptoms of low iron. It can be vague, but fatigue, irritability, low mood, depression, dizziness, drop in performance, again, increased resting heart rate. There's a lot of overlap on a lot of these topics that we're talking about with the overreaching, overtraining, relative energy deficiency in sport, vitamin D, ultimately getting at performance. Because is it possible to improve our iron stores and thus improve performance? Some of the literature supports that yes, and some maybe not. But, like VO2 max, for example, has been tested based on ferritin levels.
Correlating a higher increase in VO2 max with a higher ferritin level. Now, is this, as we talked about with vitamin D, why do we want to test it? Why don't we just go out and take a whole bunch of iron or eat out of cast iron cookware every time and use a cast iron fork?
When I was growing up in the 80s, that was the recommendation.
Well, that's because you were
Cooking
in Canada.
a cast iron skillet because you get bits of the iron.
There you go.
Yeah, that's fascinating. So again, too much iron, not good. Not enough iron, also not good. Similar with vitamin D, thus makes it worth testing, which is just kind of our big summary of if something's worth getting a test for or not. So it's interesting too, iron is actually fairly difficult to get in. Probably fortified cereals has the highest levels. You can also get it from animal products and legumes and greens and such. But animal products actually don't have, you always say like eat red meat, but animal products doesn't actually have that much iron. So it's pretty hard to get your iron stores up. And
there are absorption issues.
And
some forms are better than others.
And there's absorption issues. Some forms are better than others. There's gastritis. There's using stores faster. I think, another interesting thing too, just difficult to get it in and why we end up testing and therefore supplementing is I came across, a friend was telling me one of the highest levels of iron that you can ingest is from these cereals, right? Like fortified. But then we always pour milk on our cereal and then that's inhibiting the absorption of the iron because we actually don't want to be taking iron supplementations with things like polyphenols, coffee, calcium. We do want to take it with vitamin C. We do want the acidic environment. We don't want the coffee, the calcium. So yeah, it's interesting. It's actually fairly hard to get our iron stores up orally without supplementation.
And this isn't the topic for this episode, but there's a lot of different forms of iron out there, like Trevor mentioned. It seems like there's an amino acid bound iron that's a chelated iron. Trade name is Ferrochel. I'm not necessarily promoting them. That seems like it gets around some of these issues of absorption when you do take it with things like at least calcium at least, but I don't know about the polyphenols and everything else that you're talking of. It's transported a little bit different because it's bound to an amino acid as opposed to going through normal iron transport mechanisms. Yeah.
Absorption can be a real issue. We do end up doing IV supplementation.
Which is tough in athletes and all of the IV sort of rules with WADA and everything else.
Exactly.
So, yeah.
Yep.
If somebody is subject to those rules. I'm interested on the iron side, Dr. Rudolph, when you're working with individuals, what are you looking for? We've talked about iron, we've talked about ferritin. Are those two lab values you're looking at? Are there other things like transferrin that are important so that we get an actual good picture of what's happening in the body?
Yeah. I think the best way to get a good picture of what's happening in the body, the three things to order are CBC, ferritin, CRP. So CBC is going to tell you if there's an anemia or not because it has hemoglobin, but you can have low ferritin and not be anemic. So then if your ferritin is low, we can talk about supplementing. We can talk about looking at other reasons for getting additional iron studies like the iron panel, the transferrin, the TIBC. But I don't typically get all of those other values in the iron panel because, again, if we're not going to do anything with it, why?
Yeah.
And there can be an argument made for just ferritin. In a lot of collegiate, like cross-country teams and track and field, we screen ferritin yearly. And then if ferritin's abnormal, we'll go and test CBC, iron studies, other things. But I think biggest bang for your buck on this one is CBC, CRP, and ferritin. So if you get ferritin's low, you can supplement. You can get additional tests if you want to. But if your ferritin is elevated, it's an acute phase reactant, and it could be falsely elevated after even just some, intense exercise burst because of hepcidin. So timing of iron intake is important as well as when we're testing it.
Yeah, let's talk about ferritin and those values, those elevated values.
Yeah.
If I remember back to my clinic days, I feel like we would see a lot of people with ferritin values, I don't know, kind of in the 20 or 30, maybe up to 80 range. And if I remember right, an optimal was kind of over 100 nanograms per milliliter. And when we're talking about, and you might have more, but I'm just doing this in a relative sense, when we're talking about elevated ferritin because it's an acute phase reactant with inflammation, then we're talking about ferritin values in the high hundreds to thousands, if I remember right.
Okay, that's also fascinating because, yes, I've heard that. In my world, I mean, if you just wanted to throw out a number, we're really trying just to make sure it's above 50 for altitude training.
Okay.
That being said, I have people coming in and saying, like, I need it to be 170. I need it to be...
I need it to be this number.
Which is incredibly high. That's a tough one. I won't supplement someone that high.
You won't actively try to get somebody to 170.
No.
Okay, so I guess the question that I have is this like vitamin D? Should you be having your iron levels tested? And if so, how often? And is there any timing considerations here? Like, should you not be doing this right after you do a hard workout, something like that?
So I think 2 timing considerations that we should discuss. The timing of iron intake, make sure it's 3 to 6 hours after intense exercise. And then testing of iron, ideally test 2 to 3 days after intense exercise. Interesting, there's a lot of talk about screening and testing athletes and keeping a standardization and go in the morning, be fasting. I think the key for ferritin specifically, again, we're just talking about ferritin, is making sure you're testing ideally 2 to 3 days after the intense exercise.
And should this be a regular test? Is this something that an athlete and should they be doing this annually, a couple times a year? What you feeling?
Yeah, there can be an argument made for quarterly. I think the pros are testing ferritin quarterly. The only problem with that, other than, time, money, and energy, is if you are supplementing, the effects of supplementation might not show up so quickly in that 3-month time frame, which, can be fine if you're just collecting data. I typically screen 2 or 3 times a year. Just makes it a little bit easier. Then I can use those results if we are supplementing. So 2 to 3 times a year for ferritin.
Great. Okay. Well, there's a ton more that we could talk about, as we said. Unfortunately, we're kind of hitting the end of our time here. So maybe this is a continuation later. We didn't even dive into, some of the screening you can do for overtraining, but we'll save that. So I'm going to jump into our take homes here. But before we go there, Rob, we're doing something new. Going to see how this works.
We are doing something new, Trevor. I'm actually going to take my vitamin D drip and I'm going to put it in a cast iron pan.
There we go.
That's my new thing.
You're going to run through the cast iron pan, get your little bits of iron?
Oh, that's what, okay. How do I do this?
So actually, while you're thinking about this, I got to share this. So again, going back to the 80s, all the iron fortified cereal.
Oh, yeah.
I remember in my science class, like in elementary school, we actually poured some of that cereal into a bowl and then ran a magnet over it. And I kid you not, you would see all those tiny flakes of iron just go right up. Like they're literally just putting straight up iron into the cereal. That's what fortification means.
While we're on this topic, iron's really interesting, right? Because if you take too much iron, then it just starts getting stored in random places in your body. Like the iris of your eyes can have little rust flecks in them.
That sounds painful.
I didn't think about it from that aspect.
That sounds really painful.
Well, there you go. Just don't put a magnet near your eye at that point.
No, that'd be bad. All right. So
what's the new thing we're doing that you're springing on me?
We are going to create a forum page for this episode. We're going to do this now for every episode. And we're going to ask you a question. And this is to all of you listeners. Come to our forum, engage in this conversation, answer give us your answer and see how other people are responding and give your responses to them. We want to get a conversation going. So my question for this episode is, as an athlete, have you had any special blood testing done? And what was your experience with it? Or alternatively, have you had the experience of a non-sports GP giving a wrong interpretation of your panel? Just really interesting hearing your experience as athletes. What have you seen with blood testing from an athletic standpoint?
There you go.
And with that, so you are new to the show. We always finish our episodes with our 1-minute take-homes. So this is what is the most important lesson that you hope the listeners take from the episode, or what do you think the most salient point that you wanted to make? And you have 1 minute to give us your answer, even though we never time.
Ready, go.
Okay, go. Okay, I'll go in reverse order. Number 1, biggest bang for your buck for performance in labs, arguably, is CBC, ferritin, CRP, vitamin D.
Yep.
Cannot overemphasize, continuing to give a plug for, sports medicine providers. And then I think what we kind of tried to do in this episode was sort of highlight some of the specific issues with endurance athletes that you can talk to your primary care provider that is sports trained about, which is overtraining, altitude training, anemia, relative energy deficiency in sport, which we really didn't get into a ton, but that comes into nutrition, iron, vitamin D.
Fantastic. Rob?
Wow, great summary. Not too much to add there. What I will say, though, is as athletes, I think that we are oftentimes very in tune with our body. We can feel when things aren't quite right. When you're a coach, really pay attention to your athletes. How is their mood? How is their behavior? How is their sleep? How do they sound when they're talking about exercise? And if you, as an athlete or as a coach, are recognizing these symptoms where things don't feel right, then it's okay to be honest with your doctor about that and have an in-depth, open conversation where you're advocating for yourself. I don't know that people should be trying to self-diagnose. I don't know that people should be going to their doctor looking for a particular blood test, but I 100% think that they should be going to have an open conversation with that person who is well-trained as a sports med doc in this area. And, if you need lab tests, you need lab tests. If you don't, you don't. That's totally fine.
Well, you kind of covered one that I was thinking about. So, Rob, thank you. That was great. Mine.
You're saying you had the idea first. I had it before you.
Yeah, I realized as I was saying that I was saying that.
He's like, how do I steal Rob's thunder?
I was actually trying to think as I was saying that, how do I pull myself out of this? That was horrible. I apologize. So mine, I remember when I went to the center in Canada, I started getting blood tests every couple months. It was just part of the whole system. And thinking, oh, now I'm a serious athlete. And also going through that experience of seeing all these things that were outside the normal values and going, that's scary. What does that mean? And just having the doctor go, don't worry about it. So to me, it was really interesting reading this research and seeing how often, we're talking 78, 80% of the time, elite athletes will have a positive that's just not something to worry about. It's just part of being an elite athlete. So I'm thinking about of all the times I had in the past where I was getting a little bit scared by these test results, and it was that case, and found it fascinating that these studies and our lead up to this in this conversation, we're saying getting tested all the time isn't necessarily the best way to go for an elite athlete. And I like where we landed, which is if you're going to get anything tested, iron, vitamin D, good things to get checked, but don't get obsessive about all the other things. Well, it was a pleasure having you on the show. And you're nodding your head, so.
Wait, what does that mean?
Yeah, wait, what?
Huh?
Nodding the head's agreement, right?
Oh, I'm nodding your head.
Yes.
Sorry.
Yeah, sorry, I didn't know.
Trevor's Canadian is showing. We couldn't understand his foreign accent.
Yeah, I didn't know if I was allowed to talk on this piece.
But I was enjoying because you're like,
yes,
yep.
no.
Nodding.
Nodding.
Nod.
Not in.
Yes.
Got it. Yes,
I'm
thank you.
Canadian. It's
Yeah, no.
He's slowly learned to interpret me.
Yeah, he's Canadian. It's unfortunate.
No, I genuinely enjoy talking about all this stuff. I feel like there's so much that we could talk about, so it's hard to summarize sometimes, but I completely agree with you. I really do like where we landed.
Fantastic. Well, Dr. Rudolph, a real pleasure having you on the show. Thanks for joining us.
Thank you so much. It was fun.
That was another episode of Fast Talk. The thoughts and opinions expressed in Fast Talk are those of the individual. Subscribe to Fast Talk wherever you prefer to find your favorite podcasts. Be sure to leave us a rating and a review. As always, we love your feedback. Tweet us at FastTalkLabs. Join the conversations at forum.fasttalklabs.com. or learn from our experts at fasttalklabs.com. For Dr. Lauren Rudolph, Dr. Andy Pruitt, Larry Meyer, Dr. Stephen Chung, Dr. Paul Larson, Taylor Finney, and Rob Pickles, I'm Trevor Connor. Thanks for listening.